Hello all, very good morning. In today's class, I would like to continue the topic assessment. So previously we have discussed regarding the assessment of skills, and now in this class I would like to discuss regarding the assessments of attitude. We have seen the assessment of knowledge in which we have seen essay type question, we have seen short answer question, and also we have seen objective type of question. In assessment of skills, we have seen regarding the practical examination, also we have seen objective structured clinical examination, and now here I would like to discuss you regarding the assessment of attitude. In this assessment of attitude, we are mainly checking regarding the LIKERT scale, and also we will check regarding the SEMANTIC scale. Coming to the LIKERT scale, so it was named after the psychologist LIKERT, who has developed this scale in the year 1932. So as a psychological concept measurement scale. So here this one, it is mainly used to measure the attitude, it is used to measure the values and feelings of people that involve summation of scores on the set of positive and negative declarative statements which were regarding the variables in which respondents are asked to indicate their degree of agreement or disagreement. So I will just simplify the statement here. Mainly here what they are doing, they are asking your opinion whether it is good or not, whether it is positive or negative. So whether you are agreeing to the statement or you are not agreeing to the statement. So this LIKERT scale is mainly, so you are very happy, you are happy, you have fear, or you are surprised, you are angry with the statement, or you are disadjustment with the statement, you are feeling sad with the statement. So here the LIKERT scale, it is mainly depending upon the psychological aspect. So it mainly measures your feelings, your opinion, your attitude towards it, whether you are having positive attitude, whether you are having negative attitude. So this is the LIKERT scale. I'll explain it clearly. So for example, here pick the tick mark in the appropriate column for each statement. So here they are passing you a statement and they are asking you whether you agree or whether you strongly agree, or you are agreeing uncertain, or you disagree, or you strongly disagree. So here the statement is like this: persons with multiple sex partners are at high risk of AIDS. So what you have to do, you have to keep a tick mark here. So you just think whether the person with multiple sex partners are having this AIDS, or the person with single sex partner are having AIDS. So the person with multiple sex partners, they are having this AIDS. So I strongly agree with this statement. So you can get AIDS by sharing the utensils. So here the statement is like, whenever you are sharing your plate or your utensils or your toilet seat with the AIDS person, you will get AIDS. So you have to think, will you get AIDS whenever you are using the utensils? No, I strongly disagree with this. If you share your utensils also, you won't get the AIDS. You may have AIDS by sharing the needles with others. Yes, I agree with this statement. Whenever you are sharing your needles with the others, if the other person is having this AIDS, simply you will have the AIDS. Simply you will get the AIDS. So I strongly agree with this statement. Only gay men can get AIDS. So do you agree with this statement? Only gays will get this statement. Only gays. Do you agree with this statement? Only gays will get the AIDS. No, I strongly disagree. AIDS is a curable disease. AIDS is a curable disease? Just think. No, it is not a curable disease. Just you can manage the person with the AIDS. You cannot completely bring the person out of the disease. So I strongly disagree. AIDS is not a curable disease. So this is the LIKERT scale. Hope you understood. Here what we are doing, we are passing you statement, and based on the statement you have to tick. You strongly agree. You don't agree, means you are not convinced with the statement, you disagree, or strongly disagree. So these are some of the examples. Coming to the uses of the LIKERT scale, so it is basically used to measure the attitude, values, feelings about the people about a specific concept. So here my point of view is different in the statements. Your point of view might be different in your statement. Some people will think if you share utensils also you will get the AIDS. And they will some people will think the persons with multiple sex partners only will get the AIDS, and some people will think even though you are not having multiple sex partners you will get the AIDS. Yeah, based on your attitude it depends. So here the statement is saying the same thing. So it is mainly used to measure the attitude, values, feelings of people about a specific concept, such as any kind of situation, or people, or place, or program, or practice, or policy, or so on. So these are some of the uses. The scale is mainly used to have quantified measurement of qualitative attributes of people, such as feelings, values, and attitude. And it is also used to assess the opinion about a particular abstract concept, about a particular statement. We are passing a statement or a concept and we are asking you to give the answer. So based on the Likert scale, those answers are taken. So these are some of the uses of Likert scale. Coming to the characteristics, so it is a psychological measurement tool and it has an illustrative nature. So you have to judge the situation, you have to judge the statement, and you have to give the answer. And it can pass even the neutral statements also. So it is a bipolar scaling method, and the measurement of specific number of scaling categories are there. So these are all some of the characteristics of a Likert scale. We'll see what is the scoring statement. So here we have seen, if you see the strongly agree, they will give you 5 marks. If you are not, if you are just agreeing 4, 3, 2, 1, the same ratings score will be there. So if you strongly agree, 5 points. So the person with multiple sex partners are high at high. So the person with multiple sex partners are high at risk of AIDS. Yes, I strongly agree. So 5 points. Negative statements. You can get AIDS by using the utensils. No, I strongly disagree. 5 marks. So if it is a positive statement, disagree will be having 1 mark and strongly agree will be having 5 marks. If it is a negative statement, strongly agree will have 1 mark and strongly disagree will have 5 marks. So at last what we will do here, we are giving you the score of 10 marks. So here we have given you one positive statement. If you strongly agree, you have kept 5 marks. So we kept 5 marks. If you need negative statement, you strongly disagree for that negative statement, 5 marks. So here you pass the test, you have 10 marks. But here you disagree with the statement, you will have. So here your score will be like 9. If you are uncertain, your score will be like 8. So based on your knowledge, based on your attitude towards the statement, here the scoring will be dependent. Hope you understood. If it is negative statement, scoring will come from back to first. For a negative statement, you cannot agree strongly, right? You have to agree. You have to go for strongly disagreement. For a positive statement, you cannot strongly disagree. You have to agree. You have to at least you have to strongly agree, or at least you have to agree for the statement. So in such a way, the Likert scale scoring will be taken. Hope you understood. Coming to the advantages here, it is relatively easy to construct the scale. You can simply compared to other scales, you can simply construct this Likert scale, and it is considered more reliable and valid tool to measure psychological variables, and it is very easy to administer. It is less time consuming. Simply I will pass you the statement, I will ask you whether you agree or you don't agree. So for a particular statement, if it is very disturbing, you will think for some time. You don't know whether it is correct or not. You have to think for some time and you have to go for the answer. It is very less time consuming. Coming to the disadvantages, so here you don't want to answer for this question. You don't want to answer for this question that person with multiple sex partners are high at risk of AIDS. But we have given you the question, you must answer the question. So what we are doing, we are forcing you to answer. You cannot go for and answer any other type of question here. The question which we have given you in this statement, you have to answer that question only. You agree or you don't agree, you need to keep. You are willing or not willing, you have to answer the question. And it is difficult in justifying the selection of number of categories. And here some persons will come and answer very casually. They won't take it seriously. So what it will happen? The misleading of the data will come. So even though if you don't like that person, because the person might think something bad about you, what you will do, even though the thing what he has done is wrong, in order to gain some friendship, in order to gain some money, or in order to get some bribe, what you will do, you will just simply casually you will give the rating. So what it will happen, it will lead to misleading of the data. So these are all some of the disadvantages of this Likert scale. Hope you understood this Likert scale. So if you have queries, please let me know. I'll try to explain you again and again. Coming to the semantic differential scale. So here semantic differential questions measure people attitude towards the words, objectives and concepts. So here in this type of scale, here we are having the adjective pairs. For example, they will directly ask you whether he is good or bad, whether it is beneficial or whether it is harmful. So they are listed opposite ends of bipolar scale: good, bad, pleasant, unpleasant, sad, happy. So you have to choose. You have to choose directly. So they are having mainly the adjective pair. So here semantic differential scale, it is a type of rating scale that is mainly designed to measure the connotative meaning of objectives, events and concepts. Here these connotations are mainly used to derive the attitude of objects, events and concepts. So whether it is good or bad, whether it is right or wrong, you have to judge directly here in the semantic differential scale. Example of semantic differential scale to assess the attitude of student nurse towards the patient. So here you want to, so here this is an example where you are checking the attitude of a student nurse towards this patient. So how is the working experience with the patient? You can ask whether it is pleasant or unpleasant. So you can ask him to give a rating. Whether the patient is rude or polite, whether the relationship is cold or warm, whether it is callous or considerate, whether it is inhuman or human, non-communicative or communicative, disrespecting or respectful, insincere or friendly, unconcerned or empathy. So you have to check the attitude of the student here, whether he is feeling unpleasant or pleasant, whether he is polite or rude to the patient, whether the patient is rude to him or polite to him, whether the relationship is warm or cold. You can go with this semantic differentiation scale. Mainly what you are saying, you are seeing the attitude of a student nurse toward the patient. So this is the semantic differential scale. Hope you understood. So here semantic differential scale. So we are having the adjective pairs. So directly we are evaluation. You are evaluating. You are checking the potential and you are checking the activity. So in evaluation, whether the patient or the student nurse is good or bad. So you will check whether he is kind or cruel, whether he is wise or foolish, whether he is or she is beautiful or ugly, whether they are happy or sad, whether they are sociable or unsociable, whether they are friendly or unfriendly, whether they are willing or unwilling, they are honest or dishonest, whether they are honest or dishonest. So you are checking directly, you are evaluating, you are checking the potential here. So whether they are hard or whether they are soft in their behavior, whether they are strong or whether they are weak, whether they are heavy or light, whether they are deep or shallow, potent or important, large or small, simple or complex, difficulty or easy, submissive or assertive. So you will check the potency with using the semantic differentiation scale. Coming to the activity, whether they are active or they are passive, whether they are fast or slow, hot or cold, motivated or aimless, moving or still, excitable or climb, alive or dead, emotional or emotional, bright or deep. So directly you are checking here, evaluation you are doing, potential you are doing, activity you are doing. What you are having adjective pairs. Adjective pair means one side you will have positivity and one side you have negativity. So simply you can directly go and you will just tick mark whether they are good or bad, hard or soft, active or passive. So these are some of the things, adjective pairs that were used in the semantic differential scale. Coming to the advantages and disadvantages, here it is a convenient method mainly used to assess the beliefs, attitudes and values in a quantitative form. It is very easy to administer. It provides reasonable and valid and reliable quantitative data. Coming to the disadvantages, it is very difficult to select the relevant concepts that are appropriate for any given investigation. So you have to take the relevant concept. You have to take from the evaluation, you have to take the adjectives from the potential, you have to take the adjectives from the activity chart. So it is very difficult whenever you are formulating and it is very time consuming. So this is semantic differential scale. So this is how we will use different types of scales like Likert scale and semantic scale in the measurement of attitude. Hope you understood. So with this we have completed the, so we have discussed regarding the assessment of knowledge in part A. So in part B I have discussed regarding the assessment of knowledge. In part C I have discussed regarding the assessment of skill. In part D I have discussed regarding the assessment of attitude. Hope you understood. If you have any queries, please let me know in the comment box. Thank you so much. Thanks for watching. Please like, share and subscribe the channel.